Dentists have told us our whole lives that to keep our teeth from moving and eventually falling out, and to keep our gums from bleeding, we have to go for cleanings every 6 months. We have to brush our teeth and use dental floss. And of course, stop eating sweets, right? But what they haven't told us is why there are patients who, despite brushing their teeth really well 3 or 4 times a day, using dental floss and doing everything we tell them, keep coming to the office with more bone loss and more gum bleeding every time they visit. What's going on and what are we missing here? When COVID arrived, one of the most impactful pieces of data in the history of periodontics was published. A patient with periodontitis was up to 9 times more likely to end up in intensive care if they got COVID. They were also up to 8 times more likely to lose their life if they got COVID while having periodontitis. Another important fact, patients with periodontitis have a higher probability of having heart attacks and coronary events. And not to mention, in pregnancy, patients with periodontitis have a higher risk of having a premature birth. And so there are many more connections between having periodontitis and systemic problems. But let me ask you something. Do you think periodontitis is what really caused COVID patients to end up in intensive care, or for people to have more heart attacks? And after thinking all this through, we came to the conclusion that periodontitis is not a disease, it's the message. It's a symptom, it's the manifestation of something bigger that's happening in our body. You see, friends, when there's periodontitis, what's failing isn't just the brushing and the flossing. What's failing is your immune system's ability to react correctly to a bacterial aggression. In other words, your body is overreacting to a response that should be normal. Because it's not like you caught those bacteria, the bacteria were already there. The problem is your immune system, which overreacts to those bacteria and causes bone loss. In other words, the bacteria don't cause the bone loss, your own immune system does. And why does this happen? Because of an excessive inflammatory reaction, which is curiously similar to what happened to patients who had COVID. And if you're asking, so how can we control periodontitis besides brushing and flossing? Here's how. We have to rule out if the patient has a vitamin D deficiency, insulin resistance, chronic inflammation, sustained stress, autoimmune diseases, and obstructive sleep apnea. If you notice, this disease has almost always been attacked only from the angle of cleaning and hygiene, but there are many more facets that we have to work on. And in the next videos, I'm going to tell you what those facets are that we need to work on, how we diagnose them, and what we're doing to improve patients' lives. Therefore, follow me and don't miss the next video.